Okay, so I'll continue. So we have a panel, a very distinguished panel, and we will be talking to them to discuss the road to recovery. But before that, I just want to put the context for Delhi. Delhi, as you know, capital of India, one of the largest cities of India with a population about 30.7 million, also geographically quite large, and it could be like a small country in many other parts of the world. It's also a city which has pockets of affluence, but also pockets of abject poverty. And 80% of the workers who are in Delhi work in the informal economy, which means that they work without protection, without security, and they may be also migrants, which means that their domicile and documentation is not adequate for them to access benefits. Women's workforce participation is very low in Delhi. And these informal workers work in informal spaces in the city. They also live in informal settlements, which have very poor quality of infrastructure, very poor housing, and under conditions of which are poor both for health and living. It is also, I also want to point out that we've had two very bad COVID waves, and we have seen in both the waves, we have seen migrants, workers walking back hundreds of kilometers with women and children on foot because they could not find work or could not survive in the city. We've also in the second wave seen the city gasping for oxygen, hospital beds, medical care. We've witnessed in the city very harsh lockdowns which both in their design and implementation have not factored in the precarity of life of an informal worker and the precarity of work and how he works on a daily basis and earns on a daily basis. So this is the context in which we will be looking at this study. And it is important to point out that the study looks at the various different sectors of the informal economy. And it also looks not just at questions of employment, it not looks at, but also looks at issues around food security and also relief and coping strategies. Gender is an important component of our probing, but also within which we have looked at sectors which are dominated by women workers, and also some of the issues around health and care. So with that, I'm going to just ask my colleagues, Malavika, Narayan and Majithia, both of them work for the Focal City Delhi program, to present the study and its findings to us. Yes, so welcome, and perhaps we could start.
Thank you, Shalini. I'll just share screen. So welcome everyone. Malavika and I will take you through the findings of round 2 of the study. And I just want to give some context as to what the study is and what methodology we used and who we worked with in Delhi. So the COVID-19 crisis in the informal economy study is a global longitudinal study over the period of 2 years that looks at the impact of COVID-19 on informal workers. We worked with, the study was conducted in 11 cities across the world. You can see in Latin America, Africa, Europe, North America, and Asia. And it looked at 9 sectors throughout the world as part of the study. The study was conducted through surveys, which were telephonic interviews, and also semi-structured interviews with workers and worker leaders. So the longitudinal study was to assess the impact of COVID-19 over a period of time. In Delhi, round one of the study was conducted in the first phase of reopening right after the first lockdown was ending in June, July of 2020. And round two of the study happened after the devastating second wave of lockdown in Delhi. So it was in September and October of 2021. We surveyed 209 workers across 4 sectors in round two. So these are, like Shalini mentioned, domestic workers, home-based workers, waste pickers, and street vendors. And I want to thank our partners in this study across the past 2 years, which was Seva Delhi for home-based workers and street domestic workers, Jan Pahal for street vendors, the Delhi Roundtable on solid waste management for waste pickers, and Ankit Jha and Amir Khan, who helped us coordinate the study as well. I just want to talk a little bit about what we looked at in terms of the facets of the study that we were focusing on. So the study looked specifically at the impact on livelihood, that is work and income, on the care burden and household responsibilities, on hunger, on relief measures, and also the coping measures adopted by informal workers. We also saw through this study that the impact of the crisis is ongoing, it's multifaceted. And as you can see from some of the quotes on this page, the crisis is far from over for these workers. So I just want to now invite Malavika to present some of the more nuanced findings coming out of round two of the study. Thank you. Malavika, over to you.
Thanks, Avi. Can we go to the next slide? Yes. So starting with the specific key findings that we have from round two of the study, as Avi mentioned, the round two was conducted in September, October last year, September, October 2021. And what we see, the biggest impact is, of course, the loss of work. In mid-2021, when asked whether they were able to work for even a single day in the previous month, over a quarter of workers said no. While there's some improvement in ability to work since the first round in 2020, the recovery is still not complete, as this number shows. The women-dominated sectors of home-based workers and domestic workers have had the most difficulty restarting work. For those working, average number of work days per week has fallen, with the decline being higher again for women-dominated sectors. Stability of work has also not been constant. In the past 12 months, Delhi has seen varying levels of COVID-19 infection, which has continued to affect the nature of regulations which workers have to navigate. And the main obstacles cited for inability to work are government restrictions, market closures, inability to access work permissions, market and supply chain issues, including lack of customer demand, lack of work orders, firing by employers for domestic workers, and also health concerns. The next slide. For reporting on earnings, previous one. Yeah, for reporting on earnings, for this study, we're using the median measure rather than the average to guard against any extreme high or low samples, low values within the sample. So even in this, in mid-2021, we see that median earnings for the 4 sectors are 57% of the pre-COVID-19 median. This loss is in a period of high inflation and raised cost of living, which has made it difficult to meet even basic needs. Sectorally, the 2 women-dominated sectors of home-based work and domestic work had lowest earnings even pre-pandemic, and this has dropped even further. 57% of home-based workers still report zero earnings in mid-2021, showing that there has been hardly any recovery for this sector. Even among those working, there has been a drastic fall in piece rates and slow revival of work orders. Meanwhile, for domestic workers, median income is a quarter of what they were earning before COVID due to a variety of reasons, including loss in number of days per week, loss in number of employing households for each worker, and an overall loss in bargaining power because there are so many more people who are willing to work at lower rates. Waste pickers are working fewer days per week on average and earning less than before the pandemic. They pointed out that earnings have fallen despite a rise in the price of waste materials, unlike in the first year of the pandemic, mainly owing to constraints in accessing waste due to closure of public dumping sites and privatization of the service in many parts of Delhi. For street vendors, median income has bounced back to pre-COVID level, but workers pointed out needing to work much longer hours and put in more input costs to earn the same amount. They also shared the high uncertainty as markets are the first to be closed down whenever infections rise in the city. The loss in earnings also has a gender dimension, even in the mixed gender sectors like waste picking and street vending. In mid-2021, while monthly earnings of male waste pickers are at par with what they were earning pre-pandemic, women waste pickers are earnings are not. And as most women waste pickers in Delhi work as an extension of their family's waste work or are employed by private junk dealers in small establishments, this points to an uneven recovery of the sector as a whole. Similarly, female vendors and male vendors, the gap in earnings has also further increased during the pandemic. Next slide, Avi. As informal workers are living with reduced incomes and insecurity of livelihood, this has created an atmosphere of stress and tension in the household in many different ways. Even in mid-2021, many respondents report adult and child hunger in their households in the previous month, and nearly half report food insecurity in the form of skipped meals or reduced food consumption. Care burden continues to be high, affecting both ability to work and time spent on paid work. And the burden of care responsibilities has fallen disproportionately on women. Another particular point of stress mentioned by workers is inability to pay rent and hence the anxiety about losing their place of living. Having to live with bare survival needs and making coping choices which compromise children's education was another major source of anxiety. Fear about the disease was also strong because informal workers had to continuously risk exposing themselves in order to survive, and at the same time were stigmatized as carriers of disease. Moving on to the relief measures, there has been little to no support from the government or formal institutions during the crisis. The government did not launch any cash grant scheme specifically for informal workers in any of the 4 sectors covered by this study. The most significant form of government relief was in the form of food and ration support, but the efficacy of this has also varied across time from the beginning of the crisis. The extended food assistance programs, which began in the first lockdown in 2020, were not rolled out to the same extent during the second wave, and more support was received from workers' own membership-based organizations, including food rations and facilitating last-mile delivery of government schemes. The one-time rupees 10,000 PM Swanidhi loan was availed by many street vendors, but again, this was inadequate to be able to resume livelihoods and went into coping or survival needs instead. Next, 9 in 10 respondents in our survey reported having taken one or more coping strategies to help households survive the crisis, most significantly incurring debt and drawing down savings. In total, 73% of workers had to borrow money from one source or the other, a large part of which came from family, friends, and neighbors and not formal financial institutions. Almost a third of workers have drawn down savings and report that they have, and 90% said that they had no ability to replace these savings, which means that the long-term vulnerability of workers and their families has increased manifold in these 2 years. So lastly, given this ongoing severe crisis, I just want to mention some of the key demands from government that workers expressed in our study. The first and foremost was support to resume livelihoods by rolling back negative measures like the closure and restrictions on weekly markets in Delhi, or the closing of dhalaus, which restricts waste pickers' access to waste. Second was for recognition and regulation to ensure payment of minimum wages and social protection, for which it is hoped that the ongoing e-Shram registrations process could be a step towards. A third important message was of do no harm by preventing evictions and harassment of workers in public space, and also regulating the powers of private employer bodies like resident welfare associations, which are imposing many costs on workers. Fourth, informal workers and their organizations need a seat at the table and should be considered as key stakeholders. And fifth, there is a need for long-term measures such as continued nutrition support, access to decent housing, childcare, and other basic services. So we'll end here. Thank you.
Thank you, Malavika. Thank you, Malavika. We'll now go over to our panelists. We have with us 4 people, very distinguished. And let me introduce them first, and then we'll go to each one of them. We have with us Jagruti Devi. Jagruti Devi was a waste picker in pre-COVID times, but became a domestic worker and continued to sort waste to cope with the problems that she was facing. Jagruti Devi lives in Delhi, in South Delhi, and she's associated with an organization called BVD, Bal Vikas Dhara. We also have with us Dipa Sinha. Dipa Sinha is an assistant professor at the School of Liberal Studies, Ambedkar University in Delhi. Before joining Ambedkar University, she worked with the Office of the Commissioners of the Supreme Court, Center for Equity Studies and Public Health Research Network, and is actively involved with the Right to Food campaign. Deepa has worked extensively on issues related to food rights, nutrition, public health, and rights regularly for the media on these issues. We are also very privileged to have Dr. Amita Bhide with us. Dr. Bhide is currently the Dean and Professor in the School of Habitat Studies, Tata Institute of Social Studies, Mumbai. She has researched and has been deeply involved in issues related to urban poor communities, community organizing, and housing right movements, urban development, and governance. She attempts to develop a theoretical and action model of urbanization that is relevant for the global South through an engagement with several transformative groups in the city, province, and national scales. Also, we have with us Jenna Harvey from WIEGO. Jenna is the global coordinator for the Focal Cities program of WIEGO. In this capacity, she provides support to projects in 5 cities that aim to strengthen informal workers' organizations to advocate for their inclusion into city plans and decision-making processes. She has a bachelor's degree in global studies and a master's degree in city planning from MIT. Her specific interests are participatory planning, critical education, and inclusive models of urban economic development. Thank you to each one of you for participating in this webinar. I'm going to switch channels now and speak in Hindi to Jagruti Devi. But remember, interpretation is available. If you've chosen English, the conversation will be interpreted and made available, is available in English as well. तो जागृति देवी नमस्ते और आपका
जागृति देवी को आपको नमस्कार है।
मैं आपसे ये पूछना चाह रही थी, there is an echo of आपकी आवाज ट्रांसलेशन हिंदी में ही सुनाई पड़ रही है, राजेश। सो जागृति देवी, कैसी हैं आप? ठीक हैं? धन्यवाद। मुझे मालूम है ये समय we are hearing now the English in the Hindi channel.
Maybe this is better. Now this is it okay?
So I'm going to just go ahead. Most people will understand hopefully. So आप शाम को इधर आई हैं उसके लिए धन्यवाद, और यहाँ पे हम बात कर रहे हैं।
Sorry, we just heard Rajesh. Rajesh, when you had just spoken in the English channel, it was working. But
Okay.
just now okay, I hear you now. Okay, please go ahead. Sorry.
Yeah.
So I will speak a little. Is it okay now?
आजकल आप क्या कर रही हैं?
What are you doing nowadays, Jagruti Devi?
घर में जाके काम करती थी।
Before you used to go home and work, are you still working as a domestic worker?
आपने कब शुरू?
Namaste.
हाँ जी।
My name is Jagruti Devi or Bal Vikas Dhara. I am connected to them. I am working with them. Both you are welcome a lot. When we met earlier, at that time, after the first lockdown, you told us that you were not getting work in waste picking, and you started working at home. Why should you start that work at home? At that time, where we were living at that plot, that we had to give money, so we didn't have money. So I asked, please get me some work, and he said, will you clean the houses? I said yes. They gave me work, and I worked with him. The rent was also paid. And now, what are you doing? Are you still doing that work? Yes, I'm working in that, and also working at 2 other places. You are working at home, and waste picking is also being done. I'm not getting that much of time for that. You are not going for that. On Sunday, I do that work. Sunday, you do that work. And what do you do the whole day? You go to 3 houses at 2 times, twice. In one house, I go twice. At other, I get out at 8 a.m. At 8 a.m. you get out, and at 4 in the evening you go back. After that, again you go at 6 o'clock. And what time you return? After cooking the food, I come back. So does it make it 7 o'clock? It becomes 7 and 7:30. You work for lots of hours. Is it better for you nowadays? But before COVID, is it you are back to that position or not? No, it is not that much. It is difficulty nowadays also. What kind of difficulties? Some or the other problem is always there. Or again we have to purchase the vegetables selling part. So in the evening you sell vegetables, and do you help them in the evening? I cannot do it in the nowadays. It's not possible. So you are out for so much of time. So who takes care of the children? We just handle it. The elder is able to help me in taking care of other children. So we tell them to go to school at time and come back at time. So the responsibility is on the elder daughter. At 7 o'clock, she go out, and then she takes care of the younger brother. Does she work? She's studying it in the 9th class. So, Jagruti Devi, what kind of problems you are facing nowadays? What kind of problems you have in your work? Quickly tell us. I do not get used to get any work during that time. During both the lockdown, yes, in both the lockdowns, work was not possible. I got it from the January only, from 11th January. We are getting 3,000, but it was difficult to run house in 3,000 rupees. We had to arrange tuition for the children. Online was not possible for them. In one mobile, 3 children cannot take classes. You have only one mobile at that time. So you would have lots of problem in that. Yes. Okay. So another mobile was given to us. So we used to talk over that phone when I get calls. So the elder has one phone who is in the higher class. Now, if I ask you, Jagruti Devi, last question I'm asking. What is your demand from the government, from the Delhi government, Delhi people? What are your department? My demand is, see, they should give us good employment. We should have our own business. The work of picking rags, if you get, will you do it again? If they give good salary, I will. So you want good income and you want work. These are your demands. Thank you very much, Jagruti Devi, that you joined us and you talk to us. Thank you very much.
May I now speak to the next panelist, Deepa? Deepa, you heard both our study findings about food insecurity. You also heard about the changes in food habit, the coping strategies. And so what are the implications of this? There will be a long-term implications in terms of nutrition, health, women, with this kind of, what are the implications and what can be done to address those?
Right. Firstly, thank you for doing this study, because I think it's very important to bring out what is actually happening in people's lives, and we are hearing very little of that. I mean, we see some studies coming up from the civil society and NGOs and so on, but we don't have any official data. So each one is kind of, when you look at the results, they are vindicating the previous study. So 2 weeks back, I was in a similar panel where a similar study was done in Bangalore. Very similar kind of results. The Right to Food campaign that I'm associated with, we did a survey, Hunger Watch, in the end of 2021, which again found similar kind of results. So what we do see is that while there's one temptation to think that the pandemic is over and therefore we moved on and its life is back to normal, what all these studies are clearly showing is that over this 2 years period, a large majority of the working population in India, which is in the informal sector, their lives have not gone back to what was normal before the pandemic. Of course, the context also that even before the pandemic, it was not great. I mean, the fact that more than 90% of our workers are in the informal sector, that they don't have any social security, many of them don't even earn minimum wages. It's on the backs of that situation that we had the pandemic. And it was, of course, the periods of the lockdowns were the worst, but post-lockdown as well, they've not managed to get back to where they were. And one of the various ways in which we are seeing it has affected people, job losses, wage losses, like we've heard from Jagruti Devi's case. She's doing something else now, and she says she's still not got back to where she was, and where she was not great either. And this is something that we are seeing across the board, that So our unemployment figures might show recovery, but actually people are now in jobs which are poorer in quality and probably in quantity also in terms of number of days that they're finding work than they were able to do earlier. That's something we found as well. For instance, in our Hunger Watch 2 survey, we found that 40% people said that their food security situation in end 2021 was worse compared to what it was in early 2020. And in this context, we know that women and children have been the worst affected. If we look at children, children have of course been affected because of their families being affected, incomes being lower, the quality of food particularly coming into the house being poorer, but also that the direct services for children were disrupted throughout this period. Childcare institutions were closed, education, schools, India has the longest period of school closures across the world. And that along with schools, its education, of course, affected. Again, we heard from Jagruti Devi that even if they had a phone, they had one phone and there are multiple children in the house. So they had to do tuitions. Many could not even afford those tuitions. So education, of course, affected, but also school midday meals, therefore, were not happening. The integrated child development service, Anganwadi, through which children were getting one meal. Of course, these programs have their issues. They're not of the best quality, but whatever little support they were getting from the state as additional meal also was missing at this time when their household income levels were also low. And again, in the Hunger Watch, for instance, we found it was not, we didn't expect to, the survey was not aimed at capturing what's happening to children. Despite that, we found that in 18% of the households that we covered about 7,000 households, where we didn't really take a family household profile. So we don't know how many of them had children. But in 18% of those households, they said that a child who used to go to school before the pandemic had dropped out. And in 6% of those households, they said that a child was working for a wage outside their households. So these are, again, the other impacts that you see on children. There's, of course, the impact on malnutrition, on the younger children even more, but also that dropping out from school, getting into child labor, child marriage, all these kind of things happening again with many children is something that we've been seeing anecdotally and also is coming out in the surveys. And then the impact on women, of course.
That's what I wanted to ask.
Is partly because of what is happening to children and the way patriarchy operates, women being primarily responsible for children and childcare. We saw that burden of taking care of children also increasing on women, whether they were able to do it or not with everything else they were doing. There was that additional stress and burden of doing the home, of taking care of the rest of the family and children. That additional meal, which the child was able to eat outside, is not there. So you have to ensure that the food is available at home. So along with the increased burden of household work, what we also see is this strange contradictory situation where on the one hand, women have lost jobs more. If you look at all the employment data that's coming out from the CMIE, Azim Premji universities put out reports and so on, if we look at the job losses, it's higher amongst women. And if we look at the recovery in jobs, it's lower amongst women. At the same time, there's greater pressure on women to work. So when we actually go down and do these micro studies, we are finding that women, for instance, who were not earlier working for a wage are now doing domestic work. Women who are waste pickers are doing waste picking and domestic work. So there is that pressure definitely that one can see on women. So even in terms of their employment and employment opportunities, they've been worse affected. A lot of the jobs that were lost were the ones that women are more involved in, like your studies also showing home-based work and street vending where wages, it was home-based work and domestic work, where wages fell sharply. Again, both sectors where even, from WIEGO's work as well, is mostly women who are the workers there.
Yes.
So
Deepa, thank you for sharing that. But I want to ask you, 3 key recommendations going forward. What would a road to recovery look like?
Okay, since you say 3, I'll try and put it in 3.
Okay.
I think the first, so the first, I think as an immediate, we need to look at this as, I think it's not a short term, like we said, that a lot of the problems are the way they are because of the pandemic, but also because of the situation we had pre-pandemic. So even when we are thinking about recovery, I think we need to look at what immediately, like as a crisis response, and how do we course correct so that we are not in a similar situation again later. So immediate, I think certain things are quite clear. Again, it's coming out from your study also that there's certain relief measures or whatever you would call them, which did reach people, which reached a large section of people, and that provided some sort of a cushion. So I think the first for me would be to continue this and not to say that the pandemic is over and so we are stopping all of that, which would be the additional subsidized rations, which would be keeping the schools open, ensuring children get food. Maybe in urban areas, we need to continue cooked food in certain areas. So everything that exists on paper in India, like the public distribution system, the schools, the health system, just keeping them running and doing whatever additional little bit was being done, continuing that, and also the cash transfers, which are only one time doing that. In the long term, of course, we'll have to think about how we'll have a more employment-centered growth. Clearly, the kind of growth that we are having doesn't work. It is not creating jobs. It's not creating good, decent jobs, which provide social security. So how do we think about that longer road as well, where jobs are created, particularly for women? We know women want to work. That is not the case, that they don't want to work. But we see that the female workforce participation in India is just declining. Clearly, there is a problem of job availability. So thinking about those kind of
lowest, yeah.
Yeah.
And Delhi has one of the lowest in cities.
Delhi has one of the urban areas is really bad, which shows the lack of opportunity, I think. So.
Okay. Thanks, Deepa. That was very, very helpful. And I'm going to now move to the next person, and Dr. Amita Bhide. I feel that the speciality of work in the cities always existed, but it was the speciality of work and the places where people are living. You know, the COVID has exposed the vulnerability of these places, you know, dense communities, difficult to manage disease, etc., and the whole use of public space for work and this complete non-recognition of that. So I want to ask you, is that in terms, and then the other thing is that in a big country like India, cities then became, you know, every city had a different pattern of infection, different set of policies to contain the infection. All of them or many of them did not consider the informal work and informal workspaces. So I want to ask you, is this relationship of home, this understanding of home, not just as a place of habitat, but also as a place of work, public spaces as places of work, some of these things, how are we going to address this going forward? How are we going to address many of the issues that emerge from the speciality of informal work in our cities?
This is firstly a very interesting question. And also, firstly, let me start with both thanking you for inviting me, and also for the very interesting insights that the report provides. I think, as was said by the earlier speaker as well, it is not as if these studies are new, but I think what was really interesting for me is going through the different city reports and fact files and the differences between those cities, and the 2 rounds of the survey, which actually also illustrate how thin the recovery has been in 21, and again, how difficult it is to recover even now, and that our assumption of smooth normality is just not there. So having said that, I think in terms of specialities, I must talk about 2 things. Number one, I think localization is important, very, very important. In fact, when you ask what our cities can do for these women, I think my question is, do cities have agency really? Or are cities embroiled within the overall logic and narrative of the state governments which actually rule them? And that is what creates particular patterns. And I think it might be wiser to move into a greater narrative of localization. Of course, that kind of localization and differential policies to particular pandemics or to crisis situations has to be separated from a logic of universal entitlements within the country. And I think we equate both of these, uh, and which is why in many ways one sees that even the patterns of relief, the patterns of achieving entitlements are so very distinct. I mean, I was constantly reflecting when I was reading this report how different it would be from Mumbai, which experienced a 2 years of constant lockdown. Okay, there were no periods of relaxation in between at all, and therefore the impacts of the pandemic have been even more harsh. On the other hand, in Delhi, you have a government, a state government, which has been much more caring. In Maharashtra also, you have a state government uh, which tried to do its best in some ways. But on the other hand, it was a state government response. So while it succeeded in particular ways, it also failed in particular ways. Now let me come to the crux of the question that you are already asking, and which is about recognizing public spaces as workspaces, homes as workspaces. And I think these are really to do with our imagination of cities. And our imagination of cities, unfortunately, even now, is heavily dominated by a planner's world, that too planning, engineering, which take from a global context or a world-class aspiration, which has nothing to do in some ways with our realities. I'm not saying, and I don't even argue that there is anything wrong with aspirations. But I think these aspirations don't take a good hard look at our own realities. That we have cities where mixed use, where intense use, in fact, these are good models to have. We talk about climate change, but we often don't recognize that the kind of Western models of urban planning that we actually have uh, are actually models which lead separate production from consumption and the management of waste, which is so very different from them. They are the ones who do not rely on indigenous water resources at all. So learning from the informal economy and informality that we have, I think, so there is an issue of orientation. That's the first thing. The second thing I feel is that we don't recognize the cleavages in society at all. And when we don't recognize cleavages, cities tend to create policies which are completely blind to the actual realities that exist in the cities. Like in gender, we often use the term gender blind, right? But I think really what our cities are is also poor blind. For example, when you ban and put a complete ban on open markets, street markets, or on public transport, we know that these are going to severely impact the informal sector, be it men, be it women, be it children for that matter as well, and push them into further precarity. None of these have helped to protect them from disease at all, because it has thrown them into further desperate situations. So I think these kind of complete neglects and absences, which reflect in day-to-day policy as well. Now here, I'm not talking of larger orientation, but it really feels like we don't acknowledge the cleavages which exist in our society. And we need to therefore, once again, I think through studies like these and much better reporting, we need to acknowledge what the character of our cities is, and that it is the informal economy which in fact significantly contributes to the city economy per se. And therefore, can we build our cities from there rather than just building them from the top? The third, which I feel is very, very, very important, is that even when looking at the poor, we tend to create categories which are highly homogeneous. So now suddenly post-pandemic, we talk about a migrant worker. Okay? But what is this migrant worker? We don't, and migrant workers work in different economic sectors. No? They are heterogeneous. The conditions of living, conditions of working are different. Similarly, women in the informal economy also have diverse needs. So I think recognizing these diverse needs again is a critical point. And going forward, I think all these three dimensions become very, very critical.
Sorry about that. Thank you, Amita ji. There's one thing that Jagruti Devi said, and which sort of stuck with all of us, that how when there was no income, the burden of rent was so high that she had to go into the landlord's house and work to subsidize that rent. So the burden of rent is clearly coming out in both the rounds in many studies of what the informal workers are facing. So what I want to ask you, if we have to make some recommendations for housing for the poor, short-term, long-term, what would you recommend?
I think we have to understand the nature of the rental arrangement here. And unfortunately, I think this study does not look at one more kind of arrangement that one comes across, and which is really shared housing and worksite housing. And that is perhaps because one has covered mostly women informal workers who are part of family and family. So I think that's one thing. Having said that, I think the central government announced a 3-month rent moratorium. And clearly, this is something which only benefited, if at all it did, only in cases where there were formal rental agreements. And the kind of housing conditions, the kind of rental arrangements that we are talking about, there is a para-formal kind of process that one sees. There are agreements which are made, but these are not registered agreements. And therefore, there is no way in which any government is going to help this. So if we have to take care of this, there are only two approaches that one can follow. Number one, that housing gets recognized as part of a minimum wage package that one envisages, and that this becomes part state responsibility and a part employer responsibility. We need to also frame it in that fashion. And I think that's very, very critical in terms of moving forward.
Thank you very much. That was very, very helpful. And now I'm going to speak to the fourth panelist, which is our friend Jenna from WIEGO. Jenna, here we want to now take Delhi and put it in a global context. And given that this is a global study, can you help us understand Delhi in a more global context? And what has been the impact in other cities vis-a-vis gender, vis-a-vis the various harsh lockdowns and work, etc., and across sectors? Can you share some of those findings, comparing it perhaps or reflecting on what we have just presented from Delhi?
Sure. And first, thanks to the Delhi team and to all the panelists. Very, very interesting presentation so far. So with respect to lockdowns, work in public space, and gender impact, I can share a few global examples and try to situate Delhi in global context. So on lockdowns, all of the cities experienced some level of restrictions on movement at the start of the crisis. And those varied in duration and scope, but two cities really stand out as similar to the Indian cities in terms of severity of lockdown measures. And those two cities are Durban and Lima. And in these cities, like in Indian cities, governments instituted multi-month lockdowns that were often enforced with violence. Even when lockdowns were lifted in those cities, we saw continued harsh enforcement of restrictions, which especially impacted on workers in public space and increased their risks at work. So some examples of that reports of harassment against street vendors in 2021 were highest in those cities in Ahmedabad, Durban, Delhi, and Lima, with Lima being the highest, followed by Delhi. In addition to harassment, vendors faced health and safety risks in public space. So in 6 out of 9 cities where street vendors were surveyed, the majority had no access to water in their places of work. And this was especially pronounced in Delhi and Durban, with over 80% of vendors reporting those conditions. Then we know also with waste pickers across cities, many waste pickers work in public space, and they were also reporting increased risks at work, including exposure to medical waste and greater obstacles to accessing waste. Obstacles to accessing waste was actually reported amongst 70% of waste pickers across the cities. So we know that in Delhi, a major issue with access was access to sorting sites being blocked. Barriers in other cities were different, but also very significant in leading to decreased earnings in days of work amongst waste pickers. Other barriers included increased competition, encroachment by private firms, displacement from dump sites, and reduced quantity, among other barriers. So then moving to gender impact. So when we look at the global picture of gender impact across all 11 cities, as in Delhi, we see that women informal workers have been disproportionately impacted by the crisis. And we see that manifest in several different ways. The first I wanted to mention is impact on home-based workers. So in our study, home-based workers, a predominantly female sector, was the hardest hit sector in the study. Home-based workers' earnings were devastated in 2020 and further deteriorated in 2021 to only 2% of pre-COVID earnings levels. So that's across the sample of home-based workers in the study. Then we know that in Delhi in 2021, median earnings of home-based workers were 0. That was also the case in Ahmedabad, Tirupur, and Bangkok. It was only not the case in Pleven. Then, okay, the second way that we're seeing this manifest is that in mixed gender sectors, women are recovering earnings to a lesser degree than men, as in Delhi. So for street vendors and waste pickers, again, the global picture reflects what we're seeing in Delhi in that earnings are recovering to a lesser degree than male counterparts. And for street vendors specifically, that earnings gap was most pronounced in Delhi, Mexico City, and Pleven. Then the third area I wanted to mention is around care, which I know has come up a lot through this conversation. So we're seeing that the care work is impacting on women's ability to work and earn. So globally, although both men and women are reporting increased direct care responsibilities in 2021, the care burden is impacting livelihoods in a gendered manner, in that women reporting direct care responsibilities were working almost 2 days less on average than men with increased direct care responsibilities. So in sum, to summarize the gender picture, the global picture is largely reflective of what we're seeing in Delhi. However, it's important to note that there's one significant divergence, which is that in Delhi, when we look at another women-dominated sector, domestic workers, Delhi really stands out for the severity of impact. So while in other cities, we're seeing the domestic worker sector showing some recovery, including in one city where we saw domestic workers had recovered pre-COVID earnings, in Delhi, the picture is very different, with domestic workers only recovering 10% of their pre-COVID earnings in 2021. So there's lots of different points of comparison, and these cities do differ in the sectors that we looked at in each city. But along those 3 areas you mentioned, Shalini, those are some key highlights. Thank you.
Thank you. Thank you so much, Jenna. I know we are running out of time, but I cannot let you go because there is one very important question that we have to ask, which is that can you give us some examples of workers negotiating for a change, workers negotiating to build better from other parts of the world?
Definitely. Thanks. So Over these years of crisis, we've seen workers across these cities negotiating around a range of demands relating to direct relief and relating to recovery. We've also seen our partner organizations, worker organizations, making heroic efforts to connect their members to relief. And all of our partners in Delhi are such strong examples of that. But to go back to demands, first I wanted to share some positive examples of victories. So a big focus initially for many organizations was trying to secure access to their members for cash grants and loans. One of the biggest successes in relation to this happened in New York City, where street vendors joined with other informal workers and migrant workers across sectors in a racially and ethnically diverse coalition to demand cash relief. So in the United States, although cash grants were provided 2 times during the pandemic, undocumented workers were completely excluded from this benefit. And so these workers banded together in New York under the campaign Excluded Workers. They made calls to elected representatives, held direct actions, hunger strikes, and ultimately won their struggle for an excluded workers fund of $2.1 billion, which would provide retroactive payments to workers who had been excluded from the benefits. Also, there have been several successful struggles for social protection benefits during this time. One example from India, in Ahmedabad, Sewa lobbied for the establishment of a domestic worker welfare board to facilitate access to social security benefits, and were successful in that. That would also provide domestic workers a statutory body for engaging in regulation of working conditions. So then moving to some demands related to recovery, just very briefly, what we're seeing with recovery demands is workers not content to a return to the status quo. So some alternatives that are being proposed by our partner organizations are really being proposed in terms of mutual benefit for workers and the state. So for example, the Federation of Informal Workers of Thailand is asking for procurement quotas, that government agencies could use their procurement powers to purchase at least 30% of goods and services from informal enterprises. Workers across cities in public space are demanding clear and fair rules and regulations relating to work in public space and an end to criminalization, violence, and harassment. And unfortunately, on that front, we're seeing these demands around work in public space that argue this is a public health measure, this is an economic recovery measure, but at the same time, a threat of increasing evictions, especially where we have partners in West Africa, we're seeing evictions campaigns justified as public health campaigns. So we're seeing that this real tension around demands within public space. And then finally, a demand that cuts across geographies and sectors is for governments to involve informal workers as stakeholders in determining their terms and conditions of work. So we heard from Delhi the call for nothing for us without us, and we see that reflected in all of our partner organizations, campaigns, and demands. And it takes different forms. For example, in Lima, Durban, and Accra, workers are demanding the creation of permanent entities for ongoing dialogue with government on issues impacting on their livelihoods. In Bangkok, workers are demanding statutory representation on tripartite labor committees to achieve parity with formal workers and government representatives. But what underlies all those proposals is a desire for partnership and a conviction that mutually beneficial solutions can be found in recovery, and actually that informal workers as actors who are very close to the problems and the failings of the system and the greatest impacts of the crisis are best placed to propose solutions for recovery. So those are just a few examples. There's many more that are available in some of the outputs that we've produced, but I'll end there. Thanks, Shalini.
Thank you, Jenna. I think in this rather grim picture that we have, this is the silver lining to the dark clouds that we hear about workers' organizations and what they're seeking to achieve and how ambitiously they're trying to rebuild in such a forceful manner. So it is happening also in India. So really, I think we've run out of time. I'm not going to take more, but let us end this webinar on a more positive note, on an optimistic note, that this is not just a situation, a tragic situation, but also perhaps an opportunity for us to build back, to challenge and rework some of the situations that we exist in, some of the relationships and the precarity in which informal workers work in the cities. So unless there are any questions which I may have missed, I think we are ready to close. Are there any questions for any speakers? No. So thank you to each one of you. Jagruti Devi, आप अभी तक रुकी हुई हैं हमारे साथ. धन्यवाद. Sorry, I spoke in Hindi, but I just wanted to thank Jagruti Devi for staying with us till so late. It's nearly 8:30. And I wanted to thank all the other panelists also. Thank you very much for being here. And we will be in touch as we take this forward with each one of you. Thank you.